A warm welcome to you, our esteemed viewer. Welcome to this week's episode of You and Your Fertility, our fertility awareness online program proudly brought to you by the Love Foundation. I am still your host, Dr. Love. We are at episode 17 and today we'll be discussing a very interesting topic. The title is Ovulatory and Anovulatory Cycles. Ovulatory and anovulatory cycles. A woman is supposed to ovulate every month, and ovulation is part of the entire cycle. Like we have taught here before, a woman's cycle is divided into two phases. We have the follicular phase, which runs from the beginning of the menstrual flow and peaks at the point of ovulation. And then we have the second phase, which is the luteal phase, which runs from ovulation till the beginning of another cycle. So the ovulatory cycle is the cycle where a woman releases an egg during the entire cycle. So the entire cycle plays out as it's supposed to. The follicular phase is complete and ends at ovulation. The luteal phase starts at ovulation and ends with the beginning of another menstrual flow. But for the anovulatory cycle, this is not so. The period starts at the beginning of the cycle. The follicular phase continues to play out, but somewhere along the line, the follicles do not mature, the eggs are not released. When this happens, the cycle just jumps into the luteal phase and then plays out. Of course, pregnancy is not expected to happen because the egg is not released, and then it ends and another cycle begins with another menstrual flow. This means that the menstrual flow is not dependent on ovulation taking place. The cycle can start, menses can occur, and then along the line the egg is not released, and that cycle still plays out to the end with the beginning of another cycle and another menstrual flow. That means that the menses is not dependent on ovulation. However, ovulation will happen after the menses has taken place, and then the cycle continues to progress on to ovulation point. But in some cases, ovulation is also not completely dependent on the menses occurring. That's how you have in some situations a woman who gives birth and is breastfeeding, and somewhere along the line suddenly she's pregnant again without even having seen her period. That can happen because ovulation can take place even before the menses occurs. All these are a play of the hormones in the woman's body. So a normal cycle begins, menses flows. Somewhere along the line, there should be an interplay of hormones for ovulation to take place. Where this does not happen, ovulation can be skipped. This can happen where there is some level of hormonal imbalance. It can also happen when a woman is very, very stressed, either emotionally or physically. It can happen as a result of ill health. These factors all play a role in ensuring that the body functions the way it is supposed to. And when there is an aberration somewhere, the complete functioning might not occur, and then you can have a woman have an ovulatory cycle. Age is also a factor that plays for an ovulatory cycles, because there's a certain age a woman gets to, and then she gets into what we call the climacteric phase, where some months just skip the entire cycle playing out, and then you have cycles where ovulation did not take place, and then some other months can happen that ovulation takes place, not necessarily as a result of stress or ill health or things like that, but because of the hormonal changes beginning to happen in the woman's body as a result of her age. So how do you know when a woman is ovulating and when a woman is not ovulating? We have taught that the woman should be the master of her body in our series. So you should know what the symptoms of ovulation are for you. When the menses starts, it plays out for 4 or 5 days, as the case may be in the particular woman. We should have a period of dryness, and then you begin to have symptoms of ovulation come out. We have the cervical mucus, we have breast tenderness, we have mood changes, we have pains around the stomach region, heightened smell, spike in temperature. All these are symptoms of ovulation being about to take place. And then ovulation takes place, and then the luteal phase plays out, the cycle ends, and another cycle begins. If a woman is the master of her body, she will be able to know if she's getting symptoms of ovulation for that month. Recall that this can happen from month to month, even in the same woman. So what is important here is to note that a woman can be menstruating without ovulation taking place. And a woman should be the master of her body to know what her symptoms of ovulation are. If she knows the symptoms, she will know whether she's ovulating for that particular month or not. This will bring us to the end of today's episode. We hope you learned something. Remember, continue to follow us on our social media handles: Facebook at Waiting to Conceive, Instagram at love_foundation_, YouTube love_foundation. Keep learning, leave comments, ask questions, contact us, and continue to learn to teach others. Something exciting is happening. We are bringing our interactive sessions back in place. Following COVID, we had to stop our live seminars, but we are bringing it back this February. Stay tuned, keep following us so that you get more information on that. It will be happening on the 3rd Saturday of this February, and then subsequently as it comes up, we will give you information. So stay tuned, keep watching, keep learning, learn to teach others. Bye.